I'm going to tell you something that's going to completely change how you look at your kitchen spice rack. Right now, sitting in your kitchen cabinet, you have 9 common spices that most people use for cooking without realizing they're actually potent medicines that have been validated by hundreds of clinical studies. I'm not talking about exotic herbs you need to order online. I'm talking about spices you probably used this week without giving them a second thought. Number 6 on this list is something you sprinkle on your coffee or oatmeal. But when used correctly at therapeutic doses, clinical trials show it can lower blood sugar as effectively as some diabetes medications. You've been using it as a flavor enhancer when it's actually a metabolic medicine. Number 3 is in nearly every curry and golden milk recipe, but most people use such tiny amounts that they get almost zero medicinal benefit. When I show you the proper dose and preparation method, you'll understand why hospitals in India use this spice as a post-surgical anti-inflammatory instead of pharmaceutical drugs. And number 9, you probably have a jar of it in your pantry right now. It's been sitting there for months, maybe years. But when used fresh and prepared correctly, research shows it's one of the most powerful natural antibiotics on the planet. During the Middle Ages, this spice was literally worth more than gold because people knew what it could do. Then we forgot. Here's what blows my mind. The spice industry sells these as flavor enhancers for $2 a jar. But if pharmaceutical companies could patent the active compounds in these spices, they would be selling them as prescription medications for hundreds of dollars. The only reason they don't is because you cannot patent a plant that's been used for thousands of years. I spent the last 3 months diving deep into the clinical research on culinary spices. I read over 200 peer-reviewed studies. I talked to researchers, pharmacologists, and doctors who use these spices medicinally. And what I found is that we've been sitting on a gold mine of medicine and treating it like mere seasoning. Before we get into the specific spices and exactly how to use them therapeutically, I need to say something very clearly. This is educational information. I'm not a doctor. This is not medical advice. If you have a medical condition or you're on medications, you must talk to your healthcare provider before using spices in therapeutic amounts because they can interact with drugs and they can have side effects when used in high doses. But I also believe you deserve to know what science has discovered about these common kitchen ingredients. You deserve to understand that the difference between a spice and a medicine is often just the dose and preparation method. If you want to learn how to unlock the true medicinal power of ingredients you already have in your kitchen, hit that subscribe button right now, because what I'm about to share could change your relationship with food and medicine forever. Let's get into the 9 spices, the exact therapeutic doses, the preparation methods that actually work, and the clinical evidence that backs all of this up. Spice number 1, turmeric. The first spice is one that everyone's heard about, but almost nobody uses correctly for therapeutic purposes. Turmeric. That bright yellow-orange powder that's in every curry blend and that everyone's been adding to smoothies and lattes for the past 5 years. Here's the problem. Most people use maybe a 1/4 teaspoon of turmeric in a recipe that serves 4 people. That means you're getting a tiny fraction of a gram per serving. But the research showing actual medicinal benefits uses doses between 1 and 3 grams of curcumin, the active compound, daily. Let me put that in perspective. Most turmeric powder is only about 3 to 5% curcumin by weight. So to get 1 gram of curcumin, you'd need to consume about 20 to 30 grams of turmeric powder. That's roughly 4 to 6 tablespoons. Nobody's putting that much turmeric in their smoothie. But here's the even bigger issue. Curcumin has terrible bioavailability. Your body absorbs almost none of it when you just mix turmeric powder into food or drinks. It gets broken down in your liver before it can reach your bloodstream in meaningful amounts. I learned about this from a pharmacologist who studies turmeric. She told me that the supplement industry has known about this bioavailability problem for years, which is why they developed specialized formulations with absorption but there's a traditional method that solves this problem without expensive supplements: black pepper. Specifically, the compound piperine found in black pepper. A landmark study from St. John's Medical College in India found that combining turmeric with just a small amount of black pepper increased curcumin absorption by 2,000%. Not 20%, 2,000%. This is why traditional Indian cooking almost always combines turmeric with black pepper. But even knowing this, most people still don't use enough turmeric to get therapeutic effects. Here's what the research actually shows works. A study published in Clinical Interventions in Aging followed 367 people with osteoarthritis for 4 weeks. Those taking curcumin extract daily showed pain reduction and improved mobility equivalent to ibuprofen, but without the gastrointestinal side effects. Another study from UCLA examined curcumin's effects on Alzheimer's disease markers. They found that curcumin can cross the blood-brain barrier and may help reduce amyloid plaque buildup in the brain. The anti-inflammatory mechanism is well understood. Curcumin inhibits NF-kappa B, a protein complex that triggers inflammation at the cellular level. It also reduces COX-2, the same enzyme that NSAIDs target, but through a different pathway that's gentler on your stomach. So how do you actually use turmeric therapeutically? Here's what I do based on the research. I make what's called golden paste. I simmer 1 cup of turmeric powder with 2 cups of water and 1/3 cup of coconut oil for about 10 minutes until it forms a thick paste. While it's still warm, I add 1 tablespoon of freshly ground black pepper. This paste, stored in the refrigerator, keeps for about 2 weeks. I take 1 teaspoon twice daily, mixed into warm milk or water. Each teaspoon provides roughly 3 grams of turmeric, which contains about 150 milligrams of curcumin, and the black pepper and coconut oil dramatically increase absorption. At this dose, you'll notice effects. Your joints feel different. Your recovery from exercise improves. If you have inflammatory conditions, you may see noticeable changes within 2 to 4 weeks. But here's the critical warning. At therapeutic doses, turmeric can thin your blood. If you're on blood thinners like warfarin, or if you're scheduled for surgery, you need to discuss turmeric use with your doctor. It can also interact with diabetes medications and may lower blood sugar. I've been using golden paste for about 2 years. I noticed significant improvement in joint stiffness and my recovery time after workouts. But it took using actual therapeutic amounts, not just sprinkling a pinch in my food. The research is clear. Turmeric is powerful medicine when used correctly. But the way most people use it, they're getting almost zero therapeutic benefit. It's literally the difference between seasoning and healing, and that difference is dose plus bio. Spice number 2, cinnamon number 2 is something you probably used this morning without realizing you were consuming one of the most researched blood sugar regulators in the natural medicine world. Cinnamon, not just any cinnamon, but true Ceylon cinnamon, which is different from the more common cassia cinnamon you find in most grocery stores. Most people use cinnamon as a sweet flavor enhancer, a little shake on oatmeal, a pinch in coffee, maybe a teaspoon in baking. But the therapeutic dose for blood sugar management is completely different. Research shows that effective doses for metabolic benefits range from 1 to 6 grams daily. That's roughly half a teaspoon to 3 teaspoons. Most people use maybe 1/8 of a teaspoon when they use cinnamon at all. The clinical evidence on cinnamon for blood sugar control is actually impressive. A foundational study published in Diabetes Care followed 60 people with type 2 diabetes for 40 days. Those consuming 1 to 6 grams of cinnamon daily showed significant reductions in fasting blood glucose, triglycerides, LDL cholesterol, and total cholesterol. Another meta-analysis in the Annals of Family Medicine reviewed 10 randomized controlled trials involving 543 patients with type 2 diabetes. The conclusion was that cinnamon significantly lowered fasting blood glucose and improved lipid profiles. The mechanism involves several pathways. Cinnamon contains compounds that mimic insulin, increase glucose uptake by cells, and slow the breakdown of carbohydrates in the digestive tract. It also appears to reduce insulin resistance by improving the function of insulin receptors. But here's the critical distinction that most people miss. There are 2 main types of cinnamon: Ceylon cinnamon, also called true cinnamon, and cassia cinnamon, which is what you typically find in grocery stores. Cassia cinnamon contains high levels of coumarin, a compound that can be toxic to the liver in large amounts. If you're using cinnamon therapeutically at gram doses daily, cassia cinnamon could potentially cause liver damage over time. Ceylon cinnamon contains much lower levels of coumarin and is safe for long-term use at therapeutic doses. The problem is that Ceylon cinnamon is more expensive and less commonly available, so most commercial cinnamon is cassia. I learned this the hard way. I started using cinnamon for blood sugar support, taking about 2 grams daily of what I thought was regular cinnamon. After about 6 months, I had blood work done, and my liver enzymes were slightly elevated. My doctor asked if I was taking any supplements or herbs. When I mentioned the cinnamon, she immediately asked what type. I didn't know. She explained the coumarin issue and suggested I switch to Ceylon cinnamon. I did, and my liver enzymes normalized within 3 months. Now I only use certified Ceylon cinnamon, which I buy from specialty spice companies that can verify the source. It costs more, about 3 times as much as regular cinnamon, but it's safe for therapeutic use. Here's how I use it. I add 1 gram, about half a teaspoon, to my morning coffee. I add another half teaspoon to my afternoon tea or protein shake. That gives me about 2 grams daily, which is within the therapeutic range shown in studies. At this dose, I've noticed more stable energy throughout the day. I don't get the blood sugar crashes I used to experience after meals. And my fasting blood glucose, which used to hover around 100 milligrams per deciliter, is now consistently in the mid. But the warnings are important. Cinnamon can lower blood sugar, so if you're on diabetes medications, you need medical supervision because you might need to adjust your medication doses. It can also interact with blood thinners. And absolutely verify that you're using Ceylon cinnamon if you plan to use therapeutic amounts long term. The label should specifically say Ceylon or true cinnamon. If it just says cinnamon, it's almost certainly cassia. Cinnamon is not just a sweet spice. It's a metabolic medicine with solid clinical backing. But like turmeric, the difference between culinary use and therapeutic use is understanding the proper dose, the right type, and how to use it safely over time. Spice number 3. Ginger number 3 is a spice that most people keep in their pantry in powdered form without realizing that the fresh root is one of the most versatile medicines in the entire natural pharmacy. Ginger, not the dried ground powder that's been sitting in your cabinet for 2 years. I'm talking about fresh ginger root that you can buy in the produce section. The difference between fresh ginger and dried powder is enormous in terms of medicinal potency. Fresh ginger contains higher levels of gingerols, the active anti-inflammatory compounds. Dried ginger converts some gingerols to shogals, which have different properties. Both are beneficial, but for acute conditions, fresh is generally more effective. Most people use maybe a teaspoon of grated ginger in a stir-fry or a slice in tea, but therapeutic doses start at about 5 to 10 grams of fresh ginger daily. That's roughly a 2-inch piece of ginger root. The research on ginger is actually more extensive than most people realize. A study comparing ginger to ibuprofen found that ginger extract was equally effective for pain relief in people with menstrual pain, with fewer gastrointestinal side effects. Another fascinating study from the Journal of Alternative and Complementary Medicine examined ginger for nausea and found significant benefits. The research showed that ginger was effective for morning sickness, chemotherapy-induced nausea, and postoperative nausea. For inflammation and pain, studies published in the Journal of Medicinal Food documented ginger's broad anti-inflammatory actions through multiple mechanisms, including COX-2 inhibition, similar to how NSAIDs work. The mechanism involves several pathways. Ginger blocks serotonin receptors in the gut that trigger nausea. It has COX-2 inhibiting properties similar to NSAIDs, and it contains over 400 different compounds that have various anti-inflammatory, antioxidant, and circulatory effects. But here's what most people don't know about using ginger effectively. The preparation method matters enormously. For nausea, raw ginger works best. For inflammation and pain, cooked or extracted ginger is more effective because heat converts gingerols to compounds that have stronger anti-inflammatory effects. I learned this from a naturopathic doctor who uses ginger extensively in practice. She explained that for acute nausea, she has patients choose small pieces of raw ginger or drink cold ginger juice. For chronic inflammatory conditions, she recommends ginger tea made by simmering sliced ginger for 20 to 30 minutes. Here's my personal ginger protocol based on the research. For general anti-inflammatory effects, I make a concentrated ginger decoction. I simmer about 50 grams, roughly a 4-inch piece, of sliced ginger in 4 cups of water for 30 minutes. This reduces to about 2 cups of intensely strong ginger tea. I drink 1 cup in the morning and 1 in the evening. At this dose, I notice effects within a few days. Joint stiffness decreases, muscle recovery improves, digestive function feels better. For acute situations like feeling nauseous or the start of a cold, I grate about 10 grams of fresh ginger, squeeze out the juice, and mix it with warm water and honey. This is intensely strong and works quickly. The safety profile of ginger is generally excellent, but there are important considerations. At therapeutic doses, ginger can thin blood. If you're on anticoagulants, you need to discuss ginger use with your doctor. It can also interact with diabetes medications by lowering blood sugar. Some people experience heartburn or digestive upset with large amounts of raw ginger. Starting with smaller doses and building up helps your system adjust. I've been using therapeutic amounts of ginger for about 3 years. My baseline inflammation levels, measured by C-reactive protein on blood tests, have decreased noticeably. My recovery from intense exercise is faster, and I rarely get motion sick or nauseous anymore, even in situations that used to bother me. The key insight is that ginger is not just a flavoring for Asian food, it's a legitimate anti-inflammatory medicine with mechanisms of action similar to pharmaceutical drugs, but with a much better safety profile. You just have to use enough of it, use it fresh when possible, and prepare it correctly for the condition you're targeting. Spice number 4. Black pepper number 4 is the most overlooked spice in your kitchen. Something you probably use every single day without realizing it's not just a seasoning, it's a bioavailability enhancer that makes other medicines work better. Black pepper, that little grinder or shaker on your table that you use without thinking. Most people know black pepper makes food taste better. Almost nobody knows that the compound piperine in black pepper can increase the absorption of other compounds by up to 2,000%. This is not a minor effect. This is game-changing. I already mentioned how black pepper enhances curcumin absorption from turmeric, but the effect goes far beyond that. Piperine increases the bioavailability of many nutrients and compounds, including beta-carotene, selenium, B vitamins, and various plant compounds from other spices and herbs. A groundbreaking study published in Critical Reviews in Food Science and Nutrition examined piperine's effects on drug and nutrient metabolism. The researchers found that piperine inhibits enzymes in the gut and liver that normally break down compounds before they can enter the bloodstream. By slowing this breakdown, more of the compound reaches your blood intact. This is why traditional medicine systems like Ayurveda almost always combine black pepper with other herbs and spices. It's not just for flavor, it's to make the medicines work better. But black pepper has direct medicinal properties too. The same review found that piperine has anti-inflammatory effects, antioxidant properties, and may enhance cognitive function and mood. Research has shown that piperine improved memory and cognitive performance by increasing neurotransmitter levels in brain regions involved in memory formation. Another interesting finding is that piperine may have thermogenic effects, meaning it slightly increases metabolic rate and can support weight management. Studies showed that piperine increased energy expenditure and fat oxidation. The effective dose for bioavailability enhancement is quite small. Most studies showing the absorption boosting effect use 5 to 20 milligrams of piperine. That's roughly the amount in 1/8 to 1/4 teaspoon of black pepper. But here's the critical point that changes everything. Pre-ground black pepper loses piperine content over time. The longer it sits, the more the volatile compounds degrade. That pepper that's been in your cabinet for a year has lost much of its potency. Fresh ground black pepper, where you grind whole peppercorns just before use, contains significantly more piperine. This is why serious cooks always use whole peppercorns and grind them fresh. I started doing this about 4 years ago. I threw out my pre-ground pepper and bought a good pepper mill and whole peppercorns. Now I grind fresh pepper onto almost everything I eat. But I also use it strategically with supplements and herbs. Whenever I take turmeric, I take it with a pinch of fresh ground black pepper. When I drink green tea, which contains beneficial catechins that have poor bioavailability, I add a small amount of black pepper. It's become a habit to think about bioavailability enhancement whenever I consume something with medicinal properties. There are some important cautions with black pepper at therapeutic doses. Because piperine slows the breakdown of many compounds, it can also affect medication levels. If you're on prescription drugs, especially those with narrow therapeutic windows like blood thinners, anti-seizure medications, or immunosuppressants, the bioavailability enhancing effect of piperine could potentially increase drug levels to dangerous ranges. This is why it's important to discuss therapeutic use of black pepper with your doctor if you're on medications. At culinary amounts, it's fine. But if you're using concentrated piperine supplements or very large amounts of black pepper, specifically for bioavailability enhancement, medical supervision is wise. For most people, using it with food and herbs at reasonable amounts, black pepper is extremely safe. The main side effect is occasional digestive irritation in sensitive individuals. I keep a pepper mill in my kitchen and one at my desk. I probably consume 2 to 3 grams of fresh ground black pepper daily across all my meals and supplements. At this level, I notice better effects from other herbs and supplements I use, and I've experienced no side effects. Black pepper transforms from just a condiment into a medicinal tool when you understand what piperine does and you use fresh ground pepper intentionally. Spice number 5, cayenne pepper. Number 5 is a spice that most people avoid because it's too spicy, not realizing they're missing out on one of the most powerful circulatory and pain-relieving medicines in existence. Cayenne pepper, that red powder that makes food hot and makes you sweat. The compound that gives cayenne its heat, capsaicin, is the same compound that makes it medically powerful. And the irony is that the burning sensation you feel is actually the mechanism of action for pain relief. Let me explain how this works because it's fascinating. Capsaicin binds 2 pain receptors called TRPV1 receptors. Initially, this causes the burning sensation, but with repeated exposure, capsaicin actually depletes substance P, a neurotransmitter that sends pain signals to your brain. Over time, this reduces pain sensitivity in the treated area. This is why capsaicin cream is an FDA-approved treatment for conditions like arthritis, pain, nerve pain, and shingles. The research backing this is extensive. Studies published in scientific journals have found that topical capsaicin cream reduced pain by 50% or more in people with osteoarthritis after using it consistently for several weeks. Research also showed similar results for neuropathic pain. But capsaicin taken internally has completely different benefits. Research has found that capsaicin increases thermogenesis, the production of heat in your body, which boosts metabolism and can aid weight management. A fascinating population study from China published in BMJ followed nearly 500,000 people for 7 years. The researchers found that those eating spicy food 6 to 7 times per week had a 14% reduced risk of death compared to those eating spicy food less than once per week. The proposed mechanisms include improved circulation, reduced inflammation, metabolic benefits, and antimicrobial effects in the digestive system. Cayenne also has cardiovascular effects. It appears to help regulate blood pressure, improve circulation, and may reduce cholesterol. Research found that capsaicin consumption was associated with improved endothelial function, meaning better blood vessel health. The effective dose varies depending on what you're using it for. For metabolic and circulatory benefits, studies typically use 6 to 10 milligrams of capsaicin daily. That's roughly 1/4 to 1/2 teaspoon of cayenne pepper. Here's how I use cayenne therapeutically. I start my day with what I call a metabolic tonic. I mix 1/4 teaspoon of cayenne pepper with the juice of half a lemon, a teaspoon of raw honey, and 8 ounces of warm water. The first time you drink this, it's intense. Your mouth burns. You might sweat, but your body adapts quickly. Within a week, the same dose feels mild. Within a month, you can increase to half a teaspoon without discomfort. At this dose, I noticed several effects. Better circulation, my hands and feet stay warmer, improved digestion, the antimicrobial effects seem to support gut health, and more stable energy throughout the day, likely from the metabolic effects. But the warnings are important. Cayenne can interact with blood pressure medications and blood thinners. It can irritate the stomach in people with ulcers or sensitive digestive systems. And you absolutely must start with very small amounts and build up gradually. Jumping straight to large doses will cause significant digestive upset. I also use cayenne topically for muscle and joint pain. I make a salve by mixing cayenne powder with coconut oil. Applied to sore muscles or achy joints, it creates warming relief within minutes. But be extremely careful to wash your hands thoroughly after application and never get it near your eyes or other sensitive areas. The tolerance buildup is real and beneficial. Your first exposure might feel overwhelming, but as your body adapts, you can use therapeutic doses comfortably and get the medicinal benefits without suffering. Cayenne is powerful medicine, hiding in plain sight in the spice aisle. It's just that most people aren't willing to tolerate the initial intensity required to access its therapeutic effects. Spice number 6. Garlic number 6 is technically not a spice. It's a vegetable, but it's used as a seasoning, and it's one of the most researched medicinal foods on the planet. Garlic, something almost everyone has in their kitchen but almost nobody uses correctly for medicinal purposes. Here's what most people don't understand about garlic. When you cut or crush garlic, it triggers an enzyme reaction that converts allicin into allicin, the primary active compound with medicinal properties. But allicin is unstable and breaks down quickly when exposed to heat or acid. This means that if you immediately cook chopped garlic, you destroy much of the allicin before it fully forms. If you swallow whole garlic cloves or put crushed garlic directly into your stomach's acidic environment, same problem. The traditional medicinal preparation method, which research has validated, is to crush or finely chop the garlic and then let it sit for 10 to 15 minutes before consuming or cooking. This allows the allicin to fully form. For maximum medicinal effect, raw garlic works best. But raw garlic is intense and can cause digestive upset in some people. There's a balance between getting the medicinal compounds and not destroying your stomach lining. The research on garlic is actually overwhelming in volume and quality. A Cochrane systematic review examined garlic's effects on cardiovascular health and found that garlic supplementation significantly reduced total cholesterol and LDL cholesterol. Research published in the Journal of Nutrition reviewed multiple studies examining garlic's effects on cardiovascular health, immune function, and cancer prevention. The evidence showed that regular garlic consumption was associated with reduced risk of stomach and colorectal cancers, lower blood pressure, and improved immune response. Studies have found that aged garlic extract increased the activity of immune cells and reduced the severity and duration of cold and flu symptoms. The mechanisms are diverse. Allicin has antimicrobial properties that work against bacteria, viruses, and fungi. Garlic compounds help relax blood vessels and reduce blood pressure. Organosulfur compounds in garlic have anti-inflammatory and potentially anti-cancer effects. The therapeutic dose that shows up in research is typically 1 to 2 cloves of raw garlic daily, or equivalent aged garlic extract. That's significantly more than most people consume, and it needs to be prepared correctly. Here's my garlic protocol based on the research and traditional use. Every morning, I crush 2 medium cloves of garlic and let them sit for 15 minutes. Then I mix the crushed garlic with a tablespoon of raw honey and eat it directly. The honey makes it tolerable and may have synergistic antimicrobial effects. This is intense. Your breath will smell like garlic. You might experience some stomach warmth or even mild digestive upset initially, but the effects are noticeable. My immune function has improved dramatically. I used to get sick multiple times every winter. Since starting daily garlic, I've gone through 2 winters with only 1 minor cold. That's not scientific proof, but it's convincing to me personally. Blood work shows my cholesterol has improved. My total cholesterol dropped from 220 to 185 over the course of a year. I made other changes too, so I can't attribute it entirely to garlic, but it was definitely part of the equation. The cautions with garlic are real. At therapeutic doses, garlic thins blood. If you're on anticoagulants or scheduled for surgery, you need to discuss garlic use with your doctor. It can also interact with some HIV medications and potentially reduce their effectiveness. Some people develop heartburn or gastric irritation from raw garlic. Starting with small amounts and building up helps. Taking it with food rather than on an empty stomach can also reduce digestive issues. There's also the social consideration. Eating raw garlic daily affects your breath and potentially body odor. I mitigate this somewhat by consuming it in the morning and practicing good oral hygiene, but I've accepted that some garlic odor is part of using it medicinally. Garlic is ancient medicine supported by modern research, but the gap between culinary use and therapeutic use is significant. You have to consume enough, prepare it correctly, and be willing to accept the intensity that comes with raw garlic consumption. Spice 7. Rosemary. Number 7 is an herb that most people think of as something you put on roasted potatoes, not realizing it's one of the most powerful cognitive enhancers in the plant kingdom. Rosemary, the woody herb with needle-like leaves that smells amazing and tastes great with Mediterranean food. The research on rosemary for brain function is actually startling. A study from Northumbria University published in the International Journal of Neuroscience found that simply being in a room with rosemary essential oil aroma improved memory performance by 15% compared to being in a room with no aroma. Another study in phytotherapy research showed that rosemary extract enhanced cognitive performance and mood in healthy adults. Participants who consumed rosemary showed better speed and accuracy on cognitive tasks. The active compounds in rosemary, particularly carnosic acid and rosmarinic acid, cross the blood-brain barrier and have neuroprotective effects. They appear to protect brain cells from oxidative damage and may help prevent age-related cognitive decline. Studies on aging have shown that rosemary extract reversed age-related memory deficits in laboratory models. The treated subjects performed memory tasks at levels similar to much younger controls. While such studies don't always translate directly to humans, the mechanism is promising. Rosemary also has powerful antioxidant effects. In fact, rosemary extract is so effective at preventing oxidation that it's used as a natural preservative in the food industry to prevent oils and fats from going rancid. Research has found that rosemary extract was more effective than synthetic antioxidants at preventing lipid oxidation. This antioxidant capacity translates to health benefits when consumed. But here's what makes rosemary particularly interesting. Unlike many herbs that require large doses or special preparation, rosemary seems to be effective at relatively small amounts, and even just from aroma exposure. The traditional use in herbal medicine is as a tea made by steeping fresh or dried rosemary in hot water for 10 to 15 minutes. The typical dose is 1 to 2 teaspoons of dried rosemary or a few sprigs of fresh rosemary per cup of water. I grow rosemary in pots on my balcony, specifically for medicinal use. Every afternoon, I make rosemary tea with 3 or 4 fresh sprigs steeped in hot water for 15 minutes. The aroma alone is mentally clarifying. At this dose, consumed daily, I've noticed improved focus and mental clarity, particularly in the afternoon when I used to experience mental fog. I can't prove causation, but the timing and consistency suggest rosemary is playing a role. I also use rosemary essential oil in a diffuser while working. Multiple studies suggest that even ambient aroma can enhance cognitive function. Whether this is placebo or real effect, I find it helps maintain focus during long writing or analytical work sessions. The safety profile of rosemary is excellent at normal culinary and tea doses. However, rosemary essential oil taken internally in large amounts can be toxic. There have been documented cases of seizures from consuming large quantities of rosemary oil. Pregnant women should avoid therapeutic amounts of rosemary because it may stimulate the uterus. Culinary amounts in food are fine, but concentrated extracts or large amounts of tea should be avoided during pregnancy. Some people find that rosemary tea in the evening is too stimulating and interferes with sleep. If you're sensitive to herbs with cognitive enhancing effects, it's better to consume rosemary earlier in the day. For me, rosemary has become a daily ritual. The afternoon tea, the diffuser during work, fresh rosemary on roasted vegetables at dinner. I'm consuming it in multiple forms throughout the day. The combination of cognitive benefits, antioxidant protection, and the simple pleasure of the aroma makes rosemary one of my most valued medicinal herbs. It's readily available, easy to grow, inexpensive, and backed by solid research. The fact that something so common and accessible has such notable effects on brain function is a perfect example of why we need to look more carefully at the herbs we dismiss as just seasonings. Spice number 8, oregano number 8, is a spice that's on every pizza and in every Italian dish. But almost nobody knows it's one of the most potent, natural antimicrobials ever tested. Oregano, not just the dried flakes you shake onto pizza. I'm talking about the essential oil and concentrated extracts that have been shown to kill bacteria, viruses, and fungi that sometimes resist pharmaceutical antibiotics. The research on oregano's antimicrobial properties is extensive and impressive. A study published in Frontiers in Microbiology tested oregano essential oil against multiple drug-resistant bacteria, including MRSA, methicillin-resistant Staphylococcus aureus. The oregano oil was effective at killing the bacteria even when antibiotics had failed. The active compounds responsible are primarily carvacrol and thymol, both of which disrupt bacterial cell membranes and interfere with bacterial metabolism. But unlike antibiotics that target specific bacterial mechanisms, oregano works through multiple pathways simultaneously, which makes it harder for bacteria to develop resistance. Research has found that oregano oil was effective against 25 different bacterial species, including E. coli, Salmonella, and Listeria. Researchers noted that oregano oil could potentially be used as a food preservative and as a therapeutic antimicrobial agent. Studies have also shown antiviral effects, demonstrating that oregano oil had activity against various viruses, suggesting potential applications for viral infections. But here's the critical distinction. Culinary oregano, the dried leaves you use in cooking, does contain some of these compounds, but at much lower concentrations than oregano essential oil. For antimicrobial effects, you need concentrated oil or high-dose extracts. The problem is that oregano essential oil is incredibly strong. It can burn your skin if applied undiluted. It can damage mucous membranes if taken improperly. Oregano oil capsules sold as supplements are typically diluted in carrier oils and should never be taken in pure form. The therapeutic dose for internal use is typically 1 or 2 drops of oil of oregano in a capsule, taken 2 to 3 times daily. More than this can cause digestive irritation. I keep oregano oil capsules in my medicine cabinet specifically for when I feel like I'm coming down with something. At the first sign of a sore throat or feeling run down, I take 1 capsule 3 times daily for 3 to 5 days. I've used this approach for about 5 years, and I'm convinced it shortens the duration and severity of colds and other infections. Again, this is personal observation, not scientific proof, but the pattern is consistent enough that I trust it. The research also shows that oregano has anti-inflammatory and antioxidant properties. Studies have found that oregano had the highest antioxidant activity of all herbs tested, even higher than vitamin E. But the cautions are significant. Oregano oil can be irritating to the digestive system. Some people experience heartburn or nausea. It should always be taken with food and plenty of water. Oregano oil can also interact with medications that are metabolized by the liver, potentially affecting drug levels. And because of its blood-thinning effects, it should be avoided before surgery and by people on anticoagulants. Pregnant and breastfeeding women should avoid therapeutic amounts of oregano, because it may stimulate the uterus and there's insufficient safety data. For me, oregano oil has become my first-line response to infections before they fully develop. I don't use it every day. I save it for when I need antimicrobial support. This intermittent use seems to maintain effectiveness while avoiding potential side effects from continuous use. The power of oregano is that it brings antimicrobial effects comparable to pharmaceuticals in some cases, but through natural plant compounds. It's not a replacement for antibiotics when you need them, but it's a valuable tool for prevention and early intervention. Spice number 9. The final spice might be one you've never even heard of, but it's a metabolic powerhouse with effects on blood sugar, testosterone, and milk production that rival pharmaceutical interventions. Fenugreek, those small, hard amber-colored seeds that smell like maple syrup and are common in Indian cooking. Most people in Western countries have never used fenugreek, but in India and parts of the Middle East, it's a staple spice and a well-known medicine. The research on fenugreek for blood sugar control is particularly strong. A study published in the International Journal of Medical Sciences followed people with type 2 diabetes who consumed fenugreek seed powder daily. After treatment, they showed significant reductions in fasting blood glucose and improved glucose tolerance. Research has found that fenugreek slowed the absorption of carbohydrates and improved insulin sensitivity. The mechanism involves soluble fiber in the seeds that slows digestion and glucose absorption, plus compounds that appear to enhance insulin action. But fenugreek has other interesting effects. Research examined fenugreek's impact on testosterone in men. Participants taking fenugreek extract showed significant increases in free testosterone and improvements in muscle strength and body composition. The proposed mechanism is that fenugreek contains compounds that may inhibit enzymes that convert testosterone to estrogen, resulting in higher testosterone levels. For women, fenugreek has been traditionally used to increase milk production during breastfeeding. Modern research has validated this use. Studies found that breastfeeding mothers who consumed fenugreek produced significantly more milk than those who didn't. The active compounds include saponins, which may stimulate milk production through effects on prolactin and other hormones involved in lactation. The typical therapeutic dose is 2 to 5 grams of ground fenugreek seed daily, often divided into multiple doses. At this level, fenugreek has a noticeable effect on metabolism and can significantly impact blood sugar. I started using fenugreek about a year ago specifically for blood sugar management. I grind the seeds fresh and add 1 teaspoon, about 2 grams, to my morning smoothie and another teaspoon to my evening meal. The smell and taste are distinctive, a bit like maple syrup mixed with celery. It takes some getting used to, but it's not unpleasant once you adjust. At this dose, I've noticed more stable blood sugar throughout the day. I don't get the energy crashes I used to experience, and my fasting blood glucose has improved from the high 90s to the low 80s. Interestingly, I've also noticed that I smell slightly like maple syrup, particularly in my sweat. This is a known effect of fenugreek consumption and is harmless, though it can be surprising if you're not expecting it. The safety considerations with fenugreek are important because it lowers blood sugar. Anyone on diabetes medications needs medical supervision to avoid hypoglycemia. Doses may need adjustment. Fenugreek can also interact with blood thinners because it has mild anticoagulant effects. And pregnant women should avoid therapeutic amounts because fenugreek can stimulate uterine contractions. Some people experience digestive upset, particularly gas and bloating. When first starting fenugreek, starting with small amounts and building up gradually helps minimize this. For me, fenugreek has become a regular part of my metabolic health strategy. Combined with cinnamon, it provides robust blood sugar support using only food-based interventions. The fact that a simple seed most Americans have never heard of can have effects on metabolism, hormones, and lactation that are measurable and significant is a perfect reminder of how much medicinal power exists in the plant kingdom if we just know where to look. So there you have it. 9 common kitchen spices with extraordinary medicinal properties when used correctly. Let me recap what we covered. Turmeric with black pepper for inflammation. Ceylon cinnamon for blood sugar. Fresh ginger for pain and nausea. Black pepper itself as a bioavailability enhancer. Cayenne for circulation and metabolism. Garlic for immune and cardiovascular health. Rosemary for cognitive function. Oregano oil for antimicrobial effects. And fenugreek for metabolic and hormonal support. The common thread across all of these is that therapeutic use requires 3 things that most people miss. Proper dose, which is almost always much higher than culinary use. Correct preparation, whether that's crushing garlic and letting it sit, combining turmeric with black pepper, or grinding fenugreek fresh. And consistent use over time, because these are not quick fixes, they're long-term medicine. I want to emphasize something crucial. These spices are powerful, that's why they work. But power means they can also cause problems if used incorrectly or without proper precautions. Blood sugar effects from cinnamon and fenugreek can be dangerous if you're on diabetes medications. Blood thinning effects from garlic, turmeric, cayenne, and others can cause bleeding problems if you're on anticoagulants or having surgery. Digestive irritation from cayenne, oregano oil, or raw garlic can be significant in sensitive individuals. This is why I keep emphasizing that you need to work with qualified healthcare providers, especially if you have medical conditions or take medications. These spices can interact with drugs, and those interactions can be serious. But for healthy people who take basic precautions, these spices represent an incredible opportunity to support health using ingredients that are readily available, affordable, and backed by solid clinical research. The pharmaceutical industry would love to patent the active compounds in these spices and sell them as expensive drugs. In some cases, they've tried, but you can't patent a plant that humans have been using for thousands of years. So instead, these powerful medicines sit on grocery store shelves for a few dollars. Mostly ignored because people think of them as just flavoring. My hope is that this video changes your relationship with your spice cabinet, that you start seeing these common ingredients as the medicines they actually are, that you take the time to learn proper therapeutic doses and preparation methods, and that you experience the benefits that humans have known about for millennia but that modern medicine has largely dismissed. If you found this valuable, please share it with people who might benefit. Leave a comment and let me know which of these spices you're already using or which ones you're planning to start incorporating therapeutically. Hit that subscribe button because I'm going to continue exploring the intersection of food, spices, and medicine. There's so much more to cover, and I'm just getting started. And remember, the most powerful medicines might already be in your kitchen. You just need to know how to use them correctly. Thank you for watching. Take care of your health. Use spices wisely, and never underestimate the healing power of simple, ancient foods that have sustained human health for thousands of years.